law enforcement for years have been responding to mental health calls for service. But in and of itself, mental health isn't a crime, right? Having a mental illness or a mental health crisis isn't criminal in nature. But when someone has a friend or a loved one or a family member who's experiencing a mental health crisis, who are we trained to call from the time we're little? 911, right? So law enforcement has been responding to those for a very long time. One thing that I think Meridian Police Department did well is they recognized that our calls for service that have a mental health component to them have been steadily on the rise for years. And so rather than just having law enforcement respond to those, we have a clinician who's on staff who co-responds out with us. So what that really means is rather than 911 just showing up to a person who might be experiencing a suicidal ideation or somebody who's in a mental health crisis, it's law enforcement and our clinician.
One police shooting is too many. We would prefer never to have to use deadly force in the course of our duties, but obviously we know that that's probably not possible in the grand scheme of things. We have seen an increase in the number this year, specifically this year, but there are a number of factors involved. Certainly mental health is one of them. Substance abuse can be one. The criminal justice system in general, people who should be incarcerated who are not. But what we do know is that we can continually improve in our responses, and we can do more to try and prevent these types of situations from happening. But there are a lot of things that we as a community need to come together and do to address the mental health concerns of people. We have seen an increase in mental health related calls for service, and we know that people are suffering from mental illness, and sometimes violence goes along with that. And so we need to be able to provide resources, connect people with resources earlier on before they get into a crisis situation. But once they are in that crisis situation, we certainly have well-trained, well-experienced officers who can respond, and in the vast majority of the time, de-escalate those situations, help those people calm down and get a grip on their emotions and on their feelings, and we can connect them with resources.
So we show up on scene. The first part is to try to de-escalate the situation, build some rapport, and then figure out what kind of services that individual is needing. We typically try to get them help with through the least intrusive environment. So if that means we can create a safety plan and keep them at home with family and friends, that's what we want to do until we can get them into like a community-based mental health provider. Sometimes it's past that point of being able to safety plan, and then we need to get them to the hospital because they're in need of a quicker intervention where we can make sure that they're in fact safe. And then also we do follow up. So if we have contact with an individual, it's not just going to be that one time, here's your information for a mental health provider, but we're also going to follow up with you. And that looks different too, depending on, we typically start with like a phone call. So we don't want people feeling like law enforcement's going to show up at their house every day. We don't want them to be marked as like a problem house. So we try the phone calls first. Sometimes there's circumstances where we do want to follow up in person, maybe due to safety risk factors or things like that. So we'll do follow up in person, but typically trying to follow up in the least intrusive way and then keep them out of the criminal justice system is our goal.